Hi, I'm Mrs. Roberts, and today we're learning about AP Psychology 12.1. Explain what is meant by abnormal behavior and explain how the field of psychology classifies and diagnoses abnormal behavior. All right, so we'll start off with number one. The fact that people with psychological disorders usually experience suffering that is long lasting or disproportionate to the situation best demonstrates how psychologists often use the amount of blank present to make judgments about abnormal behaviors. All right, so if you read the textbook, you probably heard it stated or read it stated. If you're distressing to yourself or to others, dysfunctional for your person or for society, and how deviant you are or how much you violate social norms, that's what is used to kind of diagnose you. So in this particular case, the right word here would be distress, although I can see kind of some arguments for deviance and dysfunction, so I'll not ask this exact question on the quiz. All right, number two, blank means that clinicians using a system show high levels of agreement in their diagnostic decisions, whereas blank means that the diagnostic category should accurately capture the essential features of the various disorders. All right, so you should kind of be familiar with this phrase. Categories accurately capture something, and hopefully you remember that from last unit. That's really talking about validity. So that narrows us down to these two here. So now we're trying to decide which other phrase goes with that. Generally speaking, we always put reliability and validity together when we're thinking of designs, studies for clinicians. So blank means that clinicians using a system show high levels of agreement in their decisions. That just means that they would basically have interjudge reliability. So for number two, that's C. All right, number three. What is the purpose of the Diagnostic and Statistical Manual of Mental Disorders? All right, so we're going to kind of refer to this as just the DSM from this point forward. So you need to know what the purpose of the DSM is. So originally it was used to diagnose patients by containing the symptoms of everything considered a psychological disorder. It's been updated multiple times to include things that were in the past considered psychological disorders and may not be today. For example, homosexuality was listed as a psychological disorder for some time. It is no longer listed that way. We are currently on the DSM-5. It doesn't include discussion of the causes or treatment of disorders because theorists really don't agree about why something occurs and what's the best way to treat it. So we're going to go with, on this one, number 3B, to list diagnoses and symptoms. So not the explanations, not theories related, not research, not describing the causes, just a list of what those things are so they can diagnose. All right, number 4. The David Rosenhan study, in which healthy individuals got themselves admitted to psychiatric wards by pretending to hear strange voices, is most relevant to which of the following? So we have several choices here. So I'll give you a second to look at those. All right, it's really important that you know what happened in the study for you to make a good choice here. All right, so just to summarize, 8 normal individuals, including psychologist David Rosenhan, got themselves admitted to hospitals in 5 different states. They told mental health workers they were hearing strange voices, just like we see in this question, STEM. Not surprisingly, they received a diagnosis of schizophrenia upon admission. Once in the hospitals, however, they acted totally normal for the duration of their stay, and when they were discharged, after intervals ranging from 7 to 52 days, they received the diagnosis of schizophrenia in remission. So this label means that even in the absence of a deviant behavior, the disorder was still assumed to be present, even if it wasn't currently active. Once attached, and again, understandably in this case, because they had reported they heard strange voices, diagnostic labels are not easily shed, even when the disordered behaviors are no longer present. So if we know that's what this is about, we're going to go with this one, the consequences of diagnostic labeling. All right, number 5. Susan beat her husband's car with a baseball bat, but says that she cannot remember anything about the crime. At the time of the hearing, she was fully aware of what was going on in the courtroom and was able to understand the legal proceedings. Susan is likely to be judged blank. Her blank is still questionable. All right, so these are 2 terms that you need to know. You need to know which one's which. So the 2 terms that I asked you to learn about are competency and insanity. Competency refers to a defendant's state of mind at the time of the hearing. So that would go here. Insanity relates to the state of mind the defendant was in at the time they committed the crime. That's here. So competent sanity. So number 5 is A. All right, last question. Number 6, if you committed a crime while insane in the 1970s, you might have been more likely to be found insane than today. Why? All right, this relates to two pretty famous cases, the John Hinckley case and the Jeffrey Dahmer case. So we've got John Hinckley, who was acquitted and committed to a mental hospital because he was considered insane. But then later we have Jeffrey Dahmer, who was found guilty, not insane. At the time Hinckley was tried, the law required that the prosecution prove that Hinckley was sane. They could not do so beyond a reasonable doubt, and Hinckley was acquitted and sent to a mental hospital. In response to the Hinckley verdict, the law was changed, and the burden of proof was shifted from the prosecutor to the defense, who now have to convince the jury that their client is insane when he or she commits his crimes. Dahmer's attorneys were not able to prove insanity, so Dahmer was convicted of murder. So you have to prove you're insane. So in this case, we have to choose an answer choice that shows us that change. All right, so we've got in the past, so those are two pretty good stems to start with. A defendant had to be proven sane by the defense. Today, they have to be proven insane by the prosecution. And then the opposite, a defendant had to be proven sane by the prosecution. Today, they have to be proven insane by the defense. So when you have two that are sort of opposite, these are always two to go to because one of them will generally be correct and one of them won't. In this case, the right answer is D. In the past, a defendant had to be proven sane by the prosecution. Those are the people who are fighting against the person who's convicted. And today they have to be proven insane by the defense. So the defendant themselves. There we are. All right. So good luck studying. That is it.